Well, some of the requirements of participation changes that CMS is asking for are incredibly sweeping and have dramatic impact on both the operation of our facility and our ability to afford to deliver care, quality care, at the same time meeting all of this regulatory burden. These really are unfunded mandates, and they begin with such things as having an infection control specialist, even in a small building, to monitor infection control, which we didn't have before. It eliminates the confidentiality protections on quality assurance, which at the same time is counterproductive to enhancing performance. It also eliminates arbitration agreements, which basically we believe violates the arbitration laws of the United States. It also requires very complicated staffing formulas and assessments that we would have to do on an ongoing basis to determine staffing based on acuity. It also requires an incredible amount of training of employees who are not even in our direct employment. We could use agency people 1 or 2 days a week just to fill in to be sure that we're adequately covered. And now we have to give them competency tests for which we have no resources, time, or means to do. It is probably the most sweeping number of changes that have been ever suggested on our industry in the last quarter century. And while we applaud some of the initiatives and we agree with some of the objectives, putting this all into one basket at one time with no specific timeline as to phasing them in is simply untenable. Well, the way providers can respond to this is basically through our AHCA website. It's vitally important that all members make some comment, because our goal is to really inundate CMS with as many comments as possible, not that are just plain vanilla carbon copy objections. We want facilities, administrators, directors of nursing, medical directors to tell their story. Select from the web page many of the items which I just enumerated, and there are many more that will directly impact them and tell their story about how this is going to be impossible to achieve and how it's actually going to detract from the valuable time that we have and that we need to deliver hands-on care.